Hi everyone, my name is Olivia and this is Alice. In this presentation, we will delve into the topic of selective mutism, a complex and often misunderstood condition. Before we begin, we would like to pay our respects to the First Nations people observing our presentation today and acknowledge their ongoing commitment to protect the land on which we live and learn here today. Today's presentation will explore what selective mutism is, its causes, and how this impacts children's communication and learning. We will discuss challenges faced by this group and strategies to support them in school. By increasing our understanding of this condition, we can work towards creating a more inclusive and supportive environment for individuals with selective mutism.
So, what is selective mutism? Selective mutism refers to the persistent inability to talk in selected social settings in which there is an expectation for speaking and communication, for example, at school, despite having the capability to communicate comfortably. It is not a choice or a form of disobedience, but a psychological condition that affects communication. The persistent failure to speak is not better accounted for by other developmental disorders such as autism, language disorder, or other communication disorders such as stuttering. Selective mutism generally occurs between 3 to 6 years or following a life change. A diagnosis often occurs between 5 and 8 years, most often after the child enters school. Selective mutism is typically diagnosed by health professionals using a criterion that includes but are not limited to the consistent failure to speak in specific social situations, present for at least a month, according to DSM-5, the disturbance interferes with educational or occupational achievements, the symptoms are not attributable to a communication disorder or lack of knowledge of the spoken language. Although this disorder is quite uncommon, statistics have shown that every one child in 5 classes may have selective mutism. This can be debilitating to a child as it prevents success in different areas of life, such as academically and socially. Therefore, it is important that we learn more about selective mutism to support accurate identification and early intervention to maximize a child's potential to participate in different areas of life. Younger children are often more responsive to treatment, which promotes better overall prognosis.
And while the exact causes of selective mutism is not always clear and can be multifaceted, there are several major causes to consider when examining selectively mute children's behavior. In particular, selective mutism can be caused by a fear of talking to certain people. This may be due to an underlying condition such as anxiety or speech and language disorders, which makes speaking to people uncomfortable and stressful. For example, a child with disfluent speech may feel conservative in situations where they are required to speak. Their reluctance to speak may present as selective mutism. Some children may also have difficulty processing sensory information such as loud noises. A busy environment can be overwhelming for them and may cause them to shut down and become unable to speak. Behavioral inhibition may also bring about signs of selective mutism. Additionally, selective mutism can occur as a result of trauma. If a child has experienced traumatic experiences in a particular environment, such as physical or verbal bullying in the classroom or on the playground, they may become more reluctant to talk in that setting. Selective mutism can often co-occur with a number of different conditions. The following are some commonly observed comorbid conditions. Children with selective mutism may avoid speaking out of fear of being teased or mispronouncing a word using incorrect language or stuttering. They may also refuse to speak out of extreme anxiety and fear of being negatively judged by others. These two conditions frequently co-occur alongside each other, as studies have found that clinicians tend to identify elevated social anxiety in selectively mute children. Individuals with selective mutism may also experience traumatic or adverse events with elevated symptoms of PTSD. And while these disorders are interrelated, it is important to note that not all children with selective mutism will have these comorbid disorders, and the presence of comorbidities may vary among individuals. Proper assessments and comprehensive evaluations by qualified professionals are necessary to identify and address these conditions.
So when thinking about a child with selective mutism, the person, place, and activity are three main aspects of the environment that should be considered. Children with selective mutism are generally able to speak with peers or people they feel comfortable with in familiar settings or during familiar activities, such as during play. Changes in any one of the three primary factors can trigger a child's selective mutism. For example, with the same familiar person, the child could be verbal in one environment, such as on the playground, and selectively mute in another, for example, in the classroom. And within the same environment, the child could be verbal with familiar people, such as peers, but selectively mute with others. For example, classmates they don't feel comfortable with. They may also choose to whisper answers to some selected people when asked to answer a question in class. The child may be able to speak in comfortable activities, such as during paired discussions, but selectively mute during anxiety-inducing activities, such as presenting in front of the whole class. Being required to speak with unfamiliar people in unfamiliar settings or during anxiety-inducing activities can cause a child to become extremely anxious. They would therefore attempt to protect themselves from the discomfort by avoiding to speak altogether.
So selective mutism can also manifest in various ways. The following here are some major behavioral characteristics in children with selective mutism. Knowing more about these signs and symptoms can help with identifying children who may present with selective mutism in the classroom. The most prominent sign is the inability to speak in certain situations due to extreme anxiety. The child would, however, be able to talk normally in other settings, for instance, not being able to speak in class but talking normally in the playground when they are with friends they feel comfortable with. Selective mutism can also act as a coping mechanism for dealing with extreme anxiety a child feels in these uncomfortable situations. Some children will whisper or talk in a lowered voice to peers or teachers, and others may not even be able to whisper and may only be able to communicate using gestures, facial expressions, or nodding. Children with selective mutism may also appear to be socially withdrawn, for example, being scared in social situations, avoiding playgrounds with many children. They often avoid being the center of attention because they think that by drawing attention to themselves, people will expect them to talk. They may also refuse to join group activities or activities that involve talking or performing in front of other people. They can usually present as quite timid or nervous and may exhibit physical manifestations of anxiety when talking with people they don't feel comfortable with. Examples include restricted body movements, minimal facial expressions, and avoiding eye contact. Children with selective mutism often struggle to initiate conversations to ask for help, even if they have been hurt due to physical harm or need to go to the bathroom. This disorder may look slightly different from child to child, but in general, these signs are something to look out for when determining whether a child presents with selective mutism.
A child's mutism can affect their ability to socially engage and communicate, hence imposing impacts on different aspects of their daily life. Firstly, selective mutism affects the child's overall quality of life. The child usually feels extremely anxious in situations where they become selectively mute. For instance, at school, there is often an expectation for a child to speak, for example, during group or whole class activities on the playground. This constant pressure of needing to speak can lead to chronic anxiety or mood disorders. The child may also experience poor self-esteem and confidence. Children with selective mutism may withdraw themselves from social situations to avoid the expectation for them to talk. The inability to socially engage with peers or teachers at school can often lead to social isolation. The disorder can also further impact a child's educational outcomes. The inability to speak may impact opportunities for academic tasks. The child is less able to engage in activities that are beneficial for their learning, such as whole class discussions, which help with brainstorming as students bounce the ideas off each other. Constantly being worried about communication demands in the classroom may also impair the child's ability to attend to instructions in class. The anxiety can get in the way of the concentration and the ability to learn, which compromises their ability to fully participate in school situations. This can potentially lead to an underachievement of academics. Selective mutism can also impact a child's speech and language development. It reduces a child's verbal output, which means that they get less chances and opportunities to practice their verbal language and speech production. If a child becomes selectively mute at a young age, many speech and or language errors may go unidentified due to the lack of verbal output. The subsequent lack of speech and language correction means that child may suffer from ongoing issues with speech and language if the errors remain uncorrected. Lastly, the disorder can also impact a child's social aspects of life. Reduced verbal output from a child with selective mutism means that the child is less able to repair communication breakdowns. This may affect their social engagement with peers and/or adults at school, as social interactions often need to be maintained by both communication partners. The anxiety a child feels in group situations and the inability to cope in such settings may also lead to social isolation. However, in saying that, children with selective mutism may still be able to make and maintain positive friendships at school with the appropriate support.
So, what do you do if you suspect that a child has selective mutism? Well, it's important to approach the situation with sensitivity and seek appropriate professional guidance. Some steps you can take include observing and documenting. So, pay close attention to the child's communication patterns and behaviors across different settings, for example, home, school, and social gatherings. Note any instances where the child consistently fails to speak or demonstrates anxiety or reluctance in these specific situations. As a teacher, you can also express your concerns to the child's parents or guardians in a supportive and non judgmental manner. Share your observations and suggest that they seek professional evaluation. You can also reach out to qualified professionals with the parent's consent. These can include pediatricians, psychologists, and or speech language pathologists. They will have the expertise to determine if the child meets the criteria for selective mutism and rule out other possible causes. It's also important that you create a supportive and understanding environment for the child, both at home and in school. If the child is attending school, you can collaborate with the school team, including the learning support staff, as well as parents, to develop an individualized support plan. This plan could outline strategies and goals to better facilitate the child's communication. But while all these steps are listed here, remember each child is unique and their needs may vary.
Now, let's look at some ways to support a child with selective mutism in the classroom. Initially, it is very important to remove all pressure and expectations for the child to speak. Questions in general should be avoided to minimize the pressure of having the child to talk on demand. This reduces the level of anxiety they feel and gives them time to get more comfortable in the classroom setting. For example, instead of greeting the child with, "How are you today?" start with something like, "It's good to see you this morning." This removes the pressure for them to respond. Also, you can let the child know that they won't be called on to speak in class unless they want to. Suggest a signal they can make, like raising the hand if they do feel comfortable being chosen. Reassure the child that it's okay if they don't want to do this and that they are not in trouble for not speaking. Other strategies that can be considered to support students with selective mutism in the classroom include arranging with parents to bring the child in 5 to 10 minutes earlier and stay with them in the classroom to warm them up for the day. Allowing the child to spend more time with familiar individuals may help them feel more comfortable in the classroom environment. If possible and appropriate, it may be worthwhile to arrange a home visit with the parents. Gradual introduction of a key adult in a familiar environment with the presence of familiar people may help the child feel less anxious around you at school. Set up a personal timetable with the child to help them understand their schedule for the day. Not knowing how the day will progress can increase the anxiety the child feels. A visual timetable clearly and explicitly outlines to the child what is expected of them, which helps create a safe and low-stress learning environment. When the child has warmed up to the classroom environment and shows less physical manifestations of anxiety, such as frozen body posture, restlessness, and being fidgety, you can start encouraging verbal output from the child by asking them questions one-on-one. Provide them with choices to support verbal expression of ideas. Some examples of questions you may ask include, "Do you like the pink or blue crayon better? Did you go to school by bus or car today?" It is important not to rush and to give the child enough time to respond to your questions. The child might not be able to answer your questions with real words at the beginning. However, it is important to reinforce any approximations, such as whispering or mouthing, to build on the child's confidence to communicate. Praise the child for their attempts at communicating using clear, specific praises like, "Thank you for letting me know that you like the pink crayon better." This allows the child to understand exactly what they are being praised for, so they would feel more motivated to continue doing it. If the child volunteers to be chosen but feels too anxious to speak in front of the class using their voice, let them know that a nonverbal response is an option and accept any forms of nonverbal communication such as nodding and pointing. This will be temporary with the expectation that the child will feel comfortable speaking verbally eventually if given time to warm up to their peers and the classroom environment. Where whole class involvement is inevitable, try to involve the student and acknowledge their presence to help them feel like they are part of the classroom. A way of doing so is offering an alternative way for the child to participate during these activities. For example, during show and tell, encourage the child to hold up the piece of work while you present the work to the class in a way they would have spoken. Praise the child for their efforts using specific praise like, "It was very brave of you to hold up your work. Thank you for doing that." Another way of acknowledging a child's attempts is to practice echoing. Repeat what the child has said or has attempted to say to let them know that they have been heard and understood. You can also find other alternative and appropriate way of communication for the child to express their needs, such as hunger, pain, or the need to go to the bathroom, depending on their abilities. Examples include communication cards, a communication app, or a mini whiteboard for them to write on as needed. These items should be readily available for the child, but they should not be pressured to use any of them. You can also create a friendly learning environment for children with selective mutism by educating other students on what selective mutism is and what they can do to help. By introducing the topic in a factual and respectful way, you can dispel any misconceptions or stereotypes other children may have and foster a welcoming environment for the student with selective mutism. The child can hopefully begin to feel more comfortable enough to talk in class sooner. Encourage other students to embrace the differences between each and every child and try to involve all children, including the child with selective mutism, in activities and games.
And the following here lists what not to do for children with selective mutism. First, avoid excluding children with selective mutism from classroom activities. Adaptations can be made to accommodate them as needed, for example, changing whole class discussions to small group or paired discussions to reduce anxiety and social demands of speaking. The child can be grouped with friends they feel most comfortable with to set up a buddy support system and encourage participation. Do not draw attention to the child when they do or don't speak. When offering specific praise, avoid doing that in public so it wouldn't bring unnecessary attention to the child. Also, refrain from saying things like, "I just want to hear your voice," because this calls attention to their inability to speak and puts subtle pressure on them to use their voice, which can be embarrassing or even uncomfortable for the child. Also, don't assume that the child will speak if they really need something. Avoid forcing a child with selective mutism to talk by sabotaging the situation or ignoring them and assuming that they will find a way to tell you. It is important to actively work out other ways for the child to communicate about essential things, such as having to go to the bathroom or not feeling well or asking for help. Finally, avoid making assumptions about a child's ability just based on their performance in class. A child with selective mutism may not be able to read in class because they feel anxious and uncomfortable doing so in a classroom setting, not because they actually can't read. This is where you may need to get creative and think of alternative assessment methods. For example, instead of getting the child to read aloud in class, you can allow the child to read to you on a one on one basis. You may also ask the parent to record a video of the child reading at home where they would presumably be most comfortable. So, selective mutism can often be remediated using behavioral or cognitive behavioral treatments provided by trained therapists. Details about the various treatment types are beyond the scope of this presentation, but if you feel that the child would benefit from additional support outside the classroom, you may consider discussing onward referral with parents. Meanwhile, you can continue to support the child in the classroom using strategies we've discussed above. Here we have provided some useful strategies if you would like to look more into selective mutism and other classroom strategies. So to conclude, selective mutism is a complex condition that requires a comprehensive and individualized approach to treatment. With early identification, appropriate interventions, and an ongoing supportive environment, we can help these children with selective mutism overcome communication obstacles and thrive. Thank you for getting to the end of this video. We hope this presentation has increased your understanding of selective mutism and the challenges faced by children living with this condition.